Healthcare is too expensive. Employers are offsetting costs onto their employees. Who will make health benefits affordable for hard-working Americans and their families?
You will! This is the Empowering Plans Podcast, a show dedicated to helping you once again emphasize the benefits in your benefit plan. Now prepare to learn,
Plan,
save,
and protect with the Phia Group.
Hey, how's it going? Good to see you, Nick.
Howdy, Ron. How you doing?
Welcome to another Phia Group Empowering Plans podcast. On location, calling in remote from the basement where they keep me when I'm not in the office. I'm still in an office in the basement, sharing space with a cat litter box. But hey, you know who's not a cat litter box? One of our senior attorneys in our Phia Group consulting division, Nick Bonds. How you doing, Nick?
I'm doing good. Not a cat litter box is on my business card too, so I'm glad you brought that up.
Well, you are ready to talk about something that does stink. All jokes aside, it's as with cats and other pets, you take the good with the bad. And we're going to talk about a subject that you've been following. I know that you have a lot of thoughts on the matter. And generally speaking, when we talk about health benefits, whether we're talking about individuals who are looking to secure coverage for their healthcare expenses, or we're talking about an employer who's looking to provide coverage to their valuable employees and their families, everybody wants to provide the most robust coverage they can, but recognize that sometimes they can't deal with the costs involved in providing that coverage. And so when you encounter that situation where there's this imbalance, I can't get what I want for the money I can afford, a decision needs to be made. And more often than not, that decision is going to be A, do I go ahead and decrease the quality of the coverage, right? Either maybe I cover fewer things. Do I increase my premiums, my deductibles, my copays, my coinsurance, shift more of the burden, not only of the premiums, but also the out-of-pocket on a per-treatment basis back onto the plan members and patients? Do I not increase deductibles and copays, and instead do I just bump up the premium and make the cost of this insurance someone else's problem? Or do I just completely give up and tell everybody, listen, you got to go get your own coverage on an exchange or individual policy, get on your spouse's policy. Hopefully they got a better employer than me, right? There are these tough decisions that need to be made. And anytime there's sort of a vacuum, a need or demand, especially in this wonderful country where we live and we're full of innovators and entrepreneurs, someone or someones are going to get creative and think maybe there's another option, right? Maybe there's a better way. And, if you call the Phia Group, right, we're going to take that old approach that, hey, let's educate people and let's make sure you're not paying for things you're not using. And let's make sure if there's money on the table, you're getting it back. And, let's put all these cost containment in. And frankly, if you can do it, self-funding is always a great option, right? And it sure has worked well for our plan, right, Nick? But there are others out there who have other ideas. And we've been hearing about those ideas in the media a lot lately. And Nick, I was hoping that you could maybe tell us a little about some of those alternative plans that we're hearing about, the different categories that they fall under, and importantly, some of the recent news coverage and things that we're hearing in the media buzzing about these alternative plans, both good and bad, and maybe share some personal experiences from the consulting team, from the work you've been doing with the company, where you've seen maybe things work out and maybe things not work out. So I'll turn the floor over to you to share some good, bad, and ugly news.
Sure, yeah. Thanks, Ron. I think, so to put some of this kind of in a historical political context, I think going back to the first Trump administration, the big push on the Republican side of the aisle was repeal and replace. It was kind of an anti-Obamacare stance. And that kind of led to this big push from the conservative wing of politics to try to find other ideas, things that could theoretically replace the Affordable Care Act. A lot of that was unsuccessful. Ultimately, the conservatives have sort of abandoned the whole approach of repealing and replacing Obamacare, and the ACA, but that did still kind of create this groundswell of some of these alternative mechanisms, and it did really drive the popularity of a lot of these alternative benefit designs. Some of the big ones that people are familiar with are like fixed indemnity plans or indemnity plans for specific diseases, like for cancer or for diabetes programs. There's also kind of a big surge in short-term limited disability plans, STLDIs. Those have kind of gained in popularity. And I think even during the first Trump administration, there were some executive orders kind of specifically aimed at broadening the availability of some of those options. One of the big things actually that the first Trump administration implemented was they basically created the two new types of health risk reimbursement arrangements, two new types of HRAs. But the big one there is the ICHRA, the individual coverage HRA. And the whole point of that is effectively, instead of an employer providing a health plan, the employer gives participants money so that they can then buy individual coverage on the marketplace. Those haven't taken off quite the way I think you might have expected them to. They do kind of shift a lot of the burden of finding coverage back onto the individual employee. They can be appealing though, like the employer gets a fixed cost and knows exactly what they might be spending on healthcare, and they're just helping the employees buy coverage, and then that coverage is actually footing the cost of all the health claims that come in. The other big HRA development was the Accepted Benefits HRA, the EBHRA. I've heard people call it the EBRA. I can't bring myself to do it. I hate it. It's just the EBHRA. That one is specifically an HRA designed to reimburse for accepted benefits. And it has a lot fewer restrictions around who it can be offered to and around how much money can be offered through it. But those were two of the big developments from Trump administration 1.0. And since then, we've still seen kind of a growth in the popularity of some of those alternative healthcare methods. One of the other big ones I forgot to mention, healthcare sharing ministries, which are effectively groups of people who share a religious affinity banding together to kind of pool their money to cover each other's costs, which sounds great in practice and it can work well, but it does have a lot of important caveats. And some of the other alternative healthcare mechanisms that we discussed, we'll kind of get into some of those a bit more. But that's kind of the broad category of benefits that we're sort of talking about today, is these plans and these arrangements that aren't traditional health coverage, that aren't fully insured products that are subject to all of the ACA's requirements, like all of the patient protections, the requirements to offer essential health benefits, but nor are they self-funded benefits that we specialize in, that are subject to ERISA and have all these protections around appeal rights and other patient protections. They don't have any of the NSA protections for emergency bills and for air ambulance claims. So these plans offer a lot and they look very appealing in a lot of ways. Typically, they are a bit more affordable than more comprehensive coverage, be that fully insured coverage or a very thoroughly designed self-funded plan like what the Phia Group offers and what we try to specialize in. But they do come with typically lower upfront costs, lower month-to-month costs. They may be a bit easier to enroll in, but they're inherently limited in the types of coverage that they offer. So the problem then becomes people trying to piece together, different components that can cover as much as they can, remaining as affordable as possible, but then they inevitably run into gaps. There are things that aren't covered. There are things that are maybe covered in a very limited manner. And that can leave participants kind of in the lurch if they do have some, God forbid, catastrophic medical issue come up. If they get hit by a car, even if like supremely healthy young people could get hit by a car and have crazy claims come in. And so then the question is like, well, what happens then? So it can, there's a lot of clear perks on paper. The question is what happens when, the rubber meets the road with their actual healthcare costs, and how do they handle those?
It's interesting, you brought up some of the different types of plans that are like this, where, it's meant to address health costs, but isn't health insurance per se.
Right.
And, one of the examples that you gave is the faith-based giving plan. And, when we heard about it, I mean, we've been hearing about those for a long time, but recently, and when I say recently, I mean in the last year, maybe last 6 months, I've actually been hearing myself a lot of radio commercials and just in general media where you, me, other people just on the street, people who aren't in the industry, they're hearing these commercials on the radio or elsewhere. And the one commercial I've been hearing in particular, it starts off by saying, hey, healthcare costs are expensive, premiums are going up, right? How can you get health benefits that are affordable? And so the way it's kind of presenting itself almost is as if this is a substitute, a direct replacement for health insurance, a health benefit plan that somebody is quote unquote paying premiums that are becoming too expensive. And I wonder if you think it's almost an issue where somebody might be enrolling in one of these plans. They've been led to believe that it's just a more affordable form of health insurance, um, and they potentially get burnt down the line. And is that maybe lack of transparency or maybe lack of awareness, if it even exists? Is that a potential pitfall, not only for the individual but also for the sponsor?
I think it really is. I think the problem that a lot of these alternative mechanisms we see people run into with a lot of these alternative mechanisms is essentially overpromising and underdelivering. A lot of them are couched exactly like you were saying, that hey, if your premiums went up in some cases, I know for marketplace coverage, some of the premiums have gone up 90% because of those expired subsidies. So there are a lot of people who suddenly had a healthcare plan on the marketplace that can no longer afford it. And a lot of them are casting about for alternatives. And if they don't have an employer who provides robust, affordable coverage, they may be tempted into something like a healthcare sharing ministry or trying to cobble together a series of indemnity plans or a STLDI to try to shore up that gap. The problem comes when maybe there are things that, yeah, like you were saying, that maybe if you go in with the assumption that, oh, this is, a one-to-one exchange, like this is just an alternative mechanism that covers the exact same thing that I had before. If individuals don't realize those gaps in coverage, it can leave them kind of holding the bag for serious healthcare issues down the line. And then, obviously employers are trying their best to provide the best healthcare and to provide the best information to their participants. Sometimes it could be as simple as maybe they don't realize, or maybe they got steered wrong by some sales pitch on the radio into thinking that, like, oh, this is going to be a perfect solution. I think I would always urge caution. If something sounds too good to be true, it probably is. And also, here at the Phia Group, we've reviewed versions of almost all of these. So if you run into one of these out in the wild and it sounds tempting, I would say, like, bring it to us. Let us take a look at it. Let us walk around, kick the tires a little bit, and see if we can identify any of those gaps that you might inadvertently leave your participants open to, or that an individual trying to buy one of these policies might run into down the road. Because
Yeah,
the average person, I feel like they just know that they need health coverage. They may not know, they try to be informed consumers. Obviously, everyone does, but for the lay person, this is an area that is really, really difficult to kind of parse. And if you don't know what you don't know, it can be really hard to see where some of those landmines are.
Yeah. And it's interesting because when you talk about, what we're doing and what we've seen and what we've reviewed, when you're talking about either a policy, a contract, even at the early stages when a program like this is first being developed, what are the potential pitfalls, the best practices? You look at who's involved, who the players are, right? If you're an employer or you're some sort of organization and you have a large group of people and you're steering them one way or the other, you want to make sure that you're taking care of them and that you're satisfying all the requirements that are set by law, regulation, etc. But at the individual level, I mean, we at the Phia Group, we don't really get phone calls from an individual who says, hey, I was in the car, I heard about this, my employer doesn't offer coverage. Is this a good deal? And so I think one is if you're an employer, a plan sponsor, and you do have just a general group of people that you're responsible for, you want to make sure that they're aware that this is out there so that they can kind of spread the good word. I would also suggest that even for the people who are developing these programs, these alternative plans, I think, and maybe I'm naive, but I think their heart is in the right place. I think they're just looking to offer solutions for a problem that exists. I think they really are trying to help. I think for many of them, they don't even realize necessarily the issues or pitfalls that they could be creating with their program. And so I would urge them to have a third party review it, advise on what the best practices are, advise on how best to communicate what it is and what it isn't, to ensure that that contract language, when somebody, an individual is signing up, that it's less likely at some point down the line, if their claims aren't paid and they file a lawsuit against you for bad faith, that they can't claim it was boilerplate language that wasn't meant to be understood by a layman, right? That you can whip out that policy and say, look at this language, they signed it, and based on it and the way it was presented and the information that was shared, they clearly understood. right? So I think that everybody benefits from taking a more careful or cautious approach and communicating clearly. The last thing I'll ask is, again, there's both at the state and federal level, there are rules and regulations that require certain amounts of coverage to be provided or obtained by individuals. And of course, we've seen a lot of political changes over the last few years, who knows? But ultimately, at the end of the day, I do also worry that if I'm an individual or an employer and I have some sort of obligation to provide some minimum health benefits, and I think that something like this is going to satisfy those requirements, I may be falling short of my responsibilities. And so I wonder if you have actually witnessed situations, not only where an individual's claim wasn't paid, but at a macro level, even if it's just discussion or theory, or if we've actually seen lawsuits or even discussions regarding potential lawsuits or liability, where a failure to satisfy a responsibility is not being satisfied by relying solely on a program like one of these.
Yeah, I mean, the biggest obvious example is just the ACA employer mandate. If there's an employer who's big enough to be subject to the ACA, some of these mechanisms, some of these plans, they would not satisfy their requirement to offer, to offer coverage that meets minimum value and is affordable. And so the employer could be trying to find the most affordable option for their employees, but still leave themselves vulnerable to tax penalties under the ACA. So really, I think the best thing, like you were saying, is to make sure that employers and their employees are all armed with as much information as possible, so that they know exactly what they're getting, what protection it offers, how robust that protection is, and where some of the holes might be.
That's fantastic. It's almost as if you knew exactly what I was talking about. And that's why I love working with you so much, Nick. So, bottom line is, as these questions and concerns pop up in the future, we're here to answer them, for good or for bad. We've seen it all. And we do want to make sure that programs like this and everybody else is succeeding and getting the most that they can for their dollar and enjoying robust benefits for low cost, but at the same time, meeting their liability, their responsibilities under law and regulations. So, we're ready to work with everybody on this and other matters. Nick, as always, it's such a pleasure working with you and talking to you. Thanks for keeping me company while I'm down here in the dungeon. But I'm going to go ahead and get back to my emails. On behalf of myself, Nick, and the entire Phia Group, thank you so much for joining us for another Empowering Plans podcast with the Phia Group. Be well.
Thank you.